Hi there, it's Dr. Hart, Nursing with Hart, PhD. I have a few questions here, practice questions on leadership management. There's a couple on ethics, delegating, and prioritization. These are popular questions to practice with, so let's get started. Which is an example of a client assault? Number 1, taking photographs of a client without the client's consent. Number 2, administering an injection that the client refused to receive. Number 3, taking the client for an x-ray when the client refused to consent. Or 4, threatening to administer a sedative to a client who is restless. Okay, we'll give you a minute and we'll come back to this one. Okay, on this one, you have to know the difference between assault and battery. These are ethical terms, ethical type questions that you should know. Preparing for your unity exams on ethics, if you have an ethics class, or even your NCLEX can have questions on ethics. So what's the difference between assault and battery? So the correct here answer is you're looking for an example of a client assault. Okay, and so the correct answer on this one is number 4, threatening to administer a sedative to a client who is restless. So the difference between an assault and battery is the assault is the threatening. Keyword threatening in this question is the intentional threat to bring about harmful or offensive contact to a client with no actual contact. Okay, threatening to administer a sedative to a client, that's an example of an assault. A battery, on the other hand, is when you actually touch the client. Okay, so number 1 is actually an invasion of privacy, taking photographs of a client without their consent. 2 and 3, administering an injection or taking the client for an x-ray are examples of battery. You're actually putting your hands on them, okay, without consent. Okay. Next one, which nurse activities may be delegated to the licensed practical nurse or licensed vocational nurse, LPN or LVN? Number 1, assessment. Number 2, urinary catheterization. 3, endotracheal suctioning. 4, intramuscular medication administration. 5, subcutaneous medication administration. Or 6, medication administration by intravenous push. And we'll give you a minute on these and we'll come back. This is a select all that apply. I forgot to put that on there, but this is a select all that apply. So there's more than one answer. Okay, let's come back. So this is a select all that apply, and this is a delegation question. So what can be delegated to the LPN, LVN? Okay, licensed practical nurse or licensed vocational nurse. Okay, so the correct answers are 2, 3, 4, and 5. Okay, so let's look at those. Urinary catheterization, 3, endotracheal suctioning, 4, intramuscular medication administration, and 5, subcutaneous medication administration. Okay, so in general, the LPN or LVN can perform tasks that the unlicensed assistive personnel can perform, such as skincare, range of motion exercises, grooming, ambulation, hygienic measures, as well as dressing changes, endotracheal suctioning, urinary catheterization, and medication administration. Oral, subcutaneous, intramuscular, and some selected piggyback medications. assessment and giving intravenous push medications are the responsibility of the registered nurse. Okay, so review those. You have to know the scope of practice for the LPN, and that's what that is. Next one. Which clients may be assigned to the licensed practical nurse or a licensed vocational nurse? Select all that apply. Once again, number 1, the client requiring oral medications. 2, the client requiring admission assessment. 3, the client requiring an intravenous injection. 4, the client requiring a subcutaneous injection. 5, the client requiring an intramuscular injection. Or 6, the client requiring insertion of a Foley catheter. So this is similar to the last one. Select all that apply. You have to know the scope of practice for the LPN. And we'll give you a minute and we'll come back. Okay, and the answers on this one are 1, 4, 5, and 6. Okay, so the LPN can do oral medications, subcutaneous injection, 5, intramuscular injection, or 6, insertion of Foley catheter. Okay, what they cannot do is assessment, which is number 2. They cannot do assessments, conduct assessments, and they cannot administer intravenous medications. These are all responsibilities of the registered nurse. Okay, so correct answers 1, 4, 5, and 6 on that one. Next one. The nurse gives an inaccurate dose of a medication to a client. Following assessment on the client, the nurse completes an incident report, calls the primary healthcare provider, and then notifies the nursing supervisor of the medication error. What does the nurse who administered the inaccurate medication dose understand about the incident report? Okay, so here are your answer choices. Number 1 is a method of promoting quality care. 2 will result in temporary job suspension. 3 is reported to the State Board of Nursing. 4 will be a part of the client's permanent medical record. We'll give you a minute to answer this one. Okay, and the answer on this one is number 1. Okay, so there it has been a medication error. The first thing the nurse will do after discovering there has been a medication error is to go and assess your client. Okay, very, very important. Before you do anything else, go and assess your client. Okay, then you can complete the incident report, call the provider, notify your supervisor of the error. Okay, and what is the understanding about the incident report? It is a method of promoting quality care. Okay, the unit or hospital will use that, okay, in a way to promote quality care. The documentation of the unusual occurrences or incidents and accidents taken as a result is internal to the institution or agency, allows the nurse and administrators to review the quality of care and decide if there's any potential risks based on the information provided in the question. The nurse will not be suspended based on this act alone. The error and the situation presented are not, or there's no reason to contact the State Board of Nursing. The incident report itself is confidential and is separated from the medical record. Okay, so the incident report is not put into the client's medical record. It is kept separate according to facility policy. All right, next one. When caring for a group of clients, the nurse considers which priority factors in order to determine which client to care for first. So these aren't specific patient scenarios. These are just general rules for how to decide your triage and which client you should care for first. Select all that apply. Number 1, complexity of illness. 2, stability of condition. 3, basic needs of the client. 4, client feelings regarding care. Or 5, time required for care delivery. And we'll give you a minute on this one. You can pause and see how you can answer this one. Okay, let's come back. And so the correct answers on this one are 1, 2, and 3. Okay, number 1, complexity of illness. 2, stability of condition. And 3, the basic needs of the client, are how the nurse would determine which client to care for first. So this is a very important priority question. Okay, these are the 3 things that the nurse would consider when deciding which client to see first. The nurse should always remember that the physiological needs are the priority. In this case, you're using Maslow's hierarchy of needs to answer this question. Okay, so complexity of illness, stability of condition, and basic needs, those are physiological needs. 4 and 5, client feelings regarding care and the time required for care delivery, are not physiological needs, so they are not the priority. Okay, and that's it for this one. I'm going to do another one very soon, so look out for that one. This will also be on this category of delegation, prioritization, management, ethics, and leadership. All right, see you on the next one. Have a great day.